Hello everyone and welcome. I am Chand from Codeforce 360. At Codeforce 360, we build Databricks native accelerators that help organizations solve real-world healthcare challenges using data and AI. Today, we are excited to showcase our Healthcare Interoperability Accelerator, a solution that helps healthcare organizations unify data across multiple clinical systems and improve operational visibility and drive better patient outcomes. Joining me is Mithun, data engineer at Coforce 360 and one of the key contributors to this accelerator. Mithun, can you briefly tell us what this accelerator is designed to solve?
Yeah, hi everyone. Hi Chan, and thank you. And today I'm here to give demo on healthcare interoperability accelerator. Let me explain the problem statement as patients go through clinical trials and all, right. So what is the workaround over there? How much time it's consuming? What is the turnaround time over the trials and the test results? This will give overall internal operation between the clinical trials and occupancy in the particular organization or hospital. And coming to healthcare data is often distributed across EHRS and laboratory systems and imaging platforms and payer systems. So the healthcare interoperability accelerator brings the data together into a single platform, helping organizations into critical operational metrics and improve data quality and end risk early and make data driven decision. So let me walk us through a interactive demo. Chan, let me share my screen. Wait, and let me share my screen. Yeah, is my screen visible, Chan?
Yeah, Mithun, you can proceed.
Yeah, this is the UI of our healthcare interoperability accelerator. We are from Codeforce and Databricks Accelerator, built on Databricks. These are the tabs of our accelerator. And coming to our first tab, executive overview tab. This will give the entire organization internal operation regarding ICU utilization and readmit risk, readmissions and labs overdue and data completeness and screening compliance. This will give overall regarding the accelerator. See ICU utilization over period, and coming to readmission rate, the person readmission rates in the sense the person who are discharged and coming to our hospital to further readmission. And this is the lab turnaround time between the trials and the results, and is the quality score trend over here, and ICU status by facility. You can see here facility general hospitals and facility Valley Health, and over here Metro Clinic and all. These are executive insights by our AI models. ICU utilization at 78% average, 0 facilities above 90% overflow threshold. So we need to go through this, and 30-day readmission risk averaging 24%. And we need to go through this. Will help our organization to make decisions and all. And this is the platform summary. And coming to this is the ICU overflow at 94% utilization. Recommend leave pending may relieve capacity within 6 hours. These are the alerts that management should go through and resolve the issues before they lead to any vast obstacle or not. Coming to our ICU capacity, this is the ICU capacity, which gives overview of the utilization and facilities, how many occupancy, how many utilization of the facilities by the patients and the organization and all. Coming to average utilization is 17%, no overflow over here, no overflow, 0 overflow facilities. Total ICU beds and beds occupied and beds available is 25, which is good enough. And coming to ICU utilization trend by facility, by hovering on it you can see over there. And coming to current utilization by facility, this is the current utilization, this is the overtime. And coming to beds occupied versus available, this is the chart you can see. Beds occupied is far good in general hospital. And coming to overflow days, this is the general hospital itself only there. And this is ICU insights by our models and ICU alerts, overflow protocol required, and capacity trend warning. And coming to readmission rate, let me summarize this tab. The person who are discharged from our hospital, they are again readmitted to our hospital having any issues or something. And this is the average 30-day risk, 24%, which is less good. Coming to high risk patients is 13 and actual readmissions is 16, and average patient age is 50 years. Most of them are old age or near to old age, and total patients 510. Total patients in the registry is 510, and the registration rate by condition or 12 months. This is one. You can see most of them conditions CHF, and then by COPD, I think sepsis, I think so. And average 30-day trial by condition, knee surgery or COPD, pneumonia, and all. This is the distribution, type distribution, or you can see most of them are low. And risk facility. This is the distribution based on their let me analyze it based on the risk tier. Based on their risk, most of them are low. Very high is very less people. And coming to risk by facility and across horizon, see valley length, and you can see here readmission insights. Diabetes readmission rate trending 7% above benchmark. You need to resolve this, or we need to go through it. This is the readmission alert, diabetic readmission spike over here regarding diabetes, and CH of follow-up gap. And this is a model performance flow, which is low, and lab turnaround time. Let me summarize this tab. This tab will give what is the mean time between the trials happened and between the results occurred. You can see average turnaround time is 2 hours, 2.6 hours, which is good. And coming to pending reviews, these are the pending reviews and overdue raise and total orders and review rate. Lab turnaround analytics over the period, and patients pending greater than 4 hours, like turnaround time, which is, and you can see in July 15 more than 14 patients are awaiting there. And turnaround by test type, see, you can see most of them is 2.5 basic metabolic, which is fast and by troponin. And coming to risk here, most of them are medium and risk. Medium and low people are having clinical trials. Obviously, FHIR also. And coming to data quality, this will give the these are the filters you can see over here, and these are the data quality checks: average completion, average coding accuracy. This is regarding the data we have. And coming to this care gaps for the provider and the patient. Provider in the sense the doctor. Total care gaps is 6,000. Patient needs screening. No, like say they need to do some clinical trials like screening test and need to go for a blood test and all. This is the count, and this is the average compliance, which is good, and below benchmark and high priority. Average days overdue, compliance rate versus benchmark over here. And patients with care gaps by screening. Patient with care gaps by screening here. Annual wellness is having more care gaps. And coming to risk distribution and days over distribution and all. This is the data import tab, which we can import our actual data of your own through. This is the schema contract, and here you can upload your files and connect your or you can view your data through Unity catalog. That's it, and let's stop my sharing. And are there any quick questions? Let me know.
Yeah, Mithun, I have some couple of questions. Mithun, what are the key benefits health organizations can gain from this accelerator?
The key benefits in the sense, the accelerator provides a unified view of healthcare operations, including ICU and readmission rate, lab turnaround performance, data quality, and all. This helps organizations improve operational efficiency and strengthen clinical decision making and enhance patient outcomes. Right? That's it, Chan.
And how does it help healthcare teams become more proactive in managing operations and patient care?
More proactive by combining data from multiple healthcare systems with AI-driven analytics. The platform helps identify ICU capacity risk and predict potential readiness and detect delays in lab processing and highlight preventive care gaps. This enables healthcare teams to take action earlier and optimize resources and deliver more effective patient care.
Yeah, thank you, Mithun. Today we saw how the Healthcare Interoperability Accelerator helps healthcare organizations unify fragmented data, improve operational visibility, identify risk earlier, and strengthen data quality, and drive better patient outcomes through AI power insights. If you are looking to build a modern healthcare intelligence platform on Databricks, we had be happy to discuss how this accelerator can support your healthcare transformation journey. Thank you for joining us today.
Yeah, thank you everyone. Thank you, Chan. Good to have you.